Hello everyone and welcome to Biohackers Lab. I'm your host, Gary Cohen, and on today's episode I have my guest, Sam Feltham. Sam is the director of the Public Health Collaboration, which is a charity dedicated to informing and implementing healthy decisions for better public health. Thanks so much for coming on today, Sam.
No worries, pleasure to be here.
So I've been following you for a while, even before you were a part of the Public Health Collaboration, because this whole show is about biohacking and being able to do N=1 stuff. And actually, just before we get into your organization, you were pretty famous in the UK because you did a really cool experiment of eating a load of calories, and you ended up making national news lines with that. So, could you just give a little bit of a story behind that quickly?
Yeah, so, this was probably about 2013. I think I started this. So coming up 4 years ago now. But I came up with this idea where I decided that I wanted to experiment to see if a calorie truly was a calorie. And because I'm a naturally lean individual, I can't really kind of put on the weight and then lose the weight, but I can do the opposite. I can put on the weight. So I decided what I'm going to do, I'm going to eat twice as much as I usually do over 21 days on 3 different diets. So the first one was low carb, high fat, real foods. So it'd be eggs and salmon and avocado for breakfast, and then like mackerel for lunch, and then steak for dinner, and I'd have copious amounts of nuts in between, and that worked shy of 6 calories per day. That was, and over 21 days, I ended up in a calorie surplus of 47,000 calories, and that's after the digestive effect of fiber, the thermogenic effect of protein, and then any exercise that I was doing as well. So it was a net calorie surplus. And that was very interesting because the calorie formula said that I should have put on 6.1 kilos with that 47,000 calorie surplus, but I only actually put on 1.3 kilos, and I actually lost 3 centimeters from my waist as well. So that's very, very interesting by itself. But I wanted to kind of take it to the next level and try a different diet, but the same amount of calories. So I gave it a 3-month washout period to kind of reset my body and my biochemical balance. And then after that 3-month period, I tried a low-fat, high-carb, fake food diet, which was cereal and skim milk for breakfast. Then it was like a skinless chicken whole grain sandwich with 0% fat yogurt, and then a low-fat lasagna and low-fat garlic bread for dinner, with kind of loads of crap snacks in between, like cola and stuff like that. And on that, I ended up again 47,000 calorie net surplus. So that's after the thermogenic effect of protein, the digestive effect of fiber, and any exercise that I was doing. And I kind of worked out that I did exactly the same exercise as well as I did from my previous experiment. Now, again, the calorie formula says that I should have put on 6.1 kilograms over those 21 days with that 47,000 calorie surplus. But I actually put on 7.1 kilograms. So it's a good 6 times the amount that I put on the low carb self-experiment. And actually on that one, I put on 9.25 centimeters around my waist.
Wow.
As well. And for a guy that's always been naturally lean, that was quite a shock, actually. So working that off was quite tiresome, and I actually kind of did a bit of an experiment 2B, because immediately following on from that second overeating experiment, I decided that I'd eat calorie maintenance. So my calorie maintenance at that point was about 3,500 calories. And I reverted back to my usual low carb, high fat, real foods diet. So again, eggs and smoked salmon for breakfast, mackerel for lunch, and then steak for dinner, that kind of thing. And eating at 3,500 calories per day. I mean, that's net as well. So I was taking into account the fiber and the protein thermogenic effect as well. And even though I was eating at this calorie maintenance of 3,500 calories, over 21 days, I lost 6.1 kilograms. So I should have stayed the same, because the idea was that I'd maintain my my weight gain by just eating at my calorie maintenance. And, if the calorie formula in its purest form is true, then I should have maintained my weight gain. But I lost 6.1 kilograms of 7.1 kilograms. And I think I lost about 7.5 centimeters off my waist as well. So obviously not right back to where I started, but a considerable loss considering that I was eating at calorie maintenance. So after that, another 3-month washout period from them, I decided to do this third and final experiment where I did very low fat, 16% fat, in fact, high carb, real food, and vegan as well. So it'd be porridge for breakfast. I think it was rice and beans for lunch. And then like potatoes and water chestnuts or something for dinner, and bananas and stuff like that in between. Quite a bit of fruit actually. And over those 21 days, I actually only ended up in a 39,000 calorie surplus. So because of the sheer amount of fiber that I was eating, I actually lost a lot of calories. Just to give the listeners and viewers a kind of a perspective on this, the recommended daily amounts for fiber in the UK is 30 grams, and I was eating 175 grams.
Wow.
So I was, my wife wasn't happy, put it that way, with what was going on in the
your
bathroom.
digestive tract,
yeah, not so good. And I mean, surprisingly, over those 21 days, I should have put on 5.2 kilograms, and I put on 4.7 kilograms. So not quite what the calorie formula said I should have, but still quite a lot more than my initial low carb experiment, which was a 47,000 calorie surplus. So I actually kind of ended up in a larger net calorie surplus on the low carb diet than the vegan one, but I still put on more weight on the vegan one. And on that one as well, I put on 7 3/4 centimeters on my waist as well. So that was absolutely fascinating.
Yeah.
That whole set of experiments, and kind of the whole point was to show that the calorie formula is kind of that it's not exactly true.
Yeah.
and different foods affect people in different ways. And the only way to do that really is to experiment on yourself, which is what Biohackers Lab is all about, really.
Exactly, yeah. And N equals 1.
Yeah, precisely. We're all N equals 1. Experiment on yourself. If you don't believe me about any of this stuff, just try it yourself, see what happens.
Yeah. And that's why I wanted people to know that story behind you, because your fascination with food and experimenting with different food groups, and especially there, just for people to hear, you were eating so many calories, and just depending on what kind of food choices you made, you could minimize metabolic disease risk by reducing your waist circumference size and not actually put on a ton of weight. But if you just ate the wrong kind of foods, you had the completely opposite effect. So it's just a powerful thing again to reinforce. Yeah, food choices are important, and that's where we come into the public health collaboration and what you are trying to do by promoting the right kind of foods, I believe.
Yeah, that's right. So it was the end of 2015 that I decided that enough was enough, and that it was time to get serious about change. So up to that point, I'd been running my fitness bootcamp business, Smash the Fat. And that's what I did the self-experiments through. I had a YouTube channel called Smash the Fat, which is you can still see all of my daily diaries on that YouTube channel if you want to check it out. But I don't post to that anymore. It's kind of like a dead channel. Like, all the content's still there, but it doesn't get updated anymore. But
it's your archive.
It's an archive. People can go see it if they want. I'd been running this fitness boot camp for 5 years. I'd grown it to 10 locations around the country, but I was becoming more and more frustrated with the number of people that were coming to us. They were desperate, really. They'd kind of tried everything, and more importantly, they kept on trying with government advice in terms of going down low fat foods, healthy whole grains and stuff like that. Yet still they remained overweight, and even obese in some cases, and had developed things like PCOS and type 2 diabetes and things. So, as I said, enough was enough at the end of 2015. So I decided that I was going to close down my business, which I did in March 2016, in order to organise a non-profit organisation that's dedicated to informing healthy decisions. And as you mentioned in our introduction, we became a registered charity as well now, thankfully. That took a year. that was quite a trial, the bureaucracy involved in that with the Charity Commission, but we got it in the end. The idea behind it is to organise and give structure to everybody's individual efforts, because there are lots of healthcare professionals out there that are very sympathetic to what a lot of us are saying, and a lot of them are quite outspoken in the media. People like Dr. Aseem Malhotra, for instance, and trying to bring those people together in order to become one voice, to have a much more powerful message is what the PHC is all about. And again, as I said, give it structure as well, and try and create change.
And so, one of your missions, three of your missions that I came across too, was that you want to change the dietary guidelines, educate GPs, and then improve public health. So I guess this comes on to what we've been touching on a little bit, but what is in the public health collaboration's view, what is the ideal food pyramid or food structure then versus what the NHS in the UK is currently recommending?
So the UK currently recommends the Eat Well Guide. It's a variation of low-fat guidelines from around the world. Even though they keep on saying that it's not low-fat guidelines, yet they say no more than 35% fat. And they recommend low-fat products over natural full-fat products. So I don't know why they keep on saying, no, they're not low-fat guidelines. It's like we're in like a, I don't know, alternate dimension or something. Yeah. So for us, the PHC, our guidelines we released last year in May, called the Real Food Lifestyle. And those are our healthy eating guidelines. Those are for people that are healthy and don't have any metabolic conditions whatsoever. And the idea behind those is to just promote real food. As long as you're getting the minimum requirements of protein, fats, vitamins and minerals, which are all the essential nutrients that the body needs, then, eat whatever real food diet works for you as an individual. If you're able to maintain personal good health, which is defined as out of the ranges of metabolic syndrome, then and you're doing that by following a low fat, high carb vegan diet, then fill your boots. If that's what's working for you, that's fine. But equally, if somebody is following a low carb, high fat, real food diet that also enables them to maintain personal good health, that's just as valid, is the point. However, where it starts to get a little bit messy for organisations like Public Health England, the governmental body the main governmental body in the UK for public health, is when you start to fall into the ranges of metabolic syndrome, then we recommend a low carbohydrate, high fat, real food diet. And that's because the RCT evidence shows that that's the most effective way of trying to treat that. If you're healthy, follow whatever real food lifestyle works for you. But if you start to fall within the ranges of metabolic syndrome, which kind of encapsulates things like type 2 diabetes, pre-diabetes, and all things like that, then you should the first thing that you should at least try is a low carb real food diet, is the point.
Okay. Yeah. So I guess the key thing we can already gauge from this is that you are promoting more low carbohydrates, and as one of my previous guests, Dr. Gary Fettke, would say, healthy fats or high fats. He likes the term healthy fats.
Yes. Yeah. So do I. I like it too.
Yeah, but it's I guess we're coming around to saying that the organization is promoting that carbohydrates isn't an essential nutrient, but fats and protein are. So, and if you get those macronutrients in real foods, don't be scared if they have natural fats in them. That other bodies might say, "Oh, keep that to a minimum," but actually, if it's in its natural form, don't worry about it.
Oh yeah. Absolutely. Yeah. It's nothing to worry about. And the thing is, track your blood work as much as you can, and if your blood work is good and you're following a certain lifestyle, and that's what's working for you, nobody can take that away from you. Mm-hmm. And that's probably the important thing to get across, and that it's all individual and a person by person basis.
And this is what the public health collaboration will help. So you did touch on it earlier, where you could have people who are even going more vegan. I would actually love to interview someone who's more low carb, high fat vegan. Yet I'm still trying to understand how that sort of diet would look like. But you could help people who make that particular lifestyle choice, all the way to people who want to eat meat too. So you're happy to accommodate both groups.
100%. Yeah, absolutely. Certainly within the realm of eating for healthy people. So again, if you are a healthy individual, as defined by out of the ranges of metabolic syndrome, and you happen to be eating a low fat vegan diet, and you're able to maintain that, then that's fine. Go for it. But then, equally, you can't take that away from somebody that's following a low carb real food diet and is also able to have stable blood glucose, low triglycerides, high HDL, and normalised blood pressure, a good waist circumference. Those are all the markers of metabolic syndrome. So if you've got all of those, you're more than likely in good shape. Although I would recommend getting your insulin levels checked as well, just in case.
Yeah, I mean, when you were talking about your personal biohacking experiment with the different diets there, you had the best result with the low carb, high fat, real food at the end of the day, where your waist went down and you didn't go much heavier in your weight. But it would have been fascinating if you did have sort of like an insulin check over that time period too, because I'm pretty sure, those other diets where you went bigger and your waist went bigger, you would have also seen your hormones would have changed dramatically. So,
I mean, I measured my my blood work on, unfortunately, at the end of the low carb diet, but my blood work was the same at the end of the low carb experiment as it was at the beginning of the second low fat experiment, where my triglycerides are at 0.5 and my blood glucose is at about 4.5, I think it was, off the top of my head, maybe 4. And then at the end of the low fat fake food experiment, my triglycerides had quadrupled. And my blood glucose was at, I think it was about 5.6.
Yeah.
And
you must have felt hungry too.
That was one of the other things with the experiments, is that on the low carb one, I really struggled to finish every single day. Once I'd finished like 1,000 calories of steak for dinner, I had 1,000 calories of almonds to eat as well. And I was eating until 11 o'clock. Like, I'd start at about 9 o'clock, maybe 8:30, and I really struggled. It took me a couple of hours to get through all of that. On the low fat fake food one, I was just able to just go straight through, easy peasy, no problem at all. I was able to keep going. I probably could have eaten more, in all honesty, on that.
So another part we mentioned earlier there with one of your missions is to educate GPs. I'd be interested to find out, how receptive have you found it so far with trying to get the message out to other GPs about the real food situation?
Over the past year, it's been really good, actually. Not to say that there haven't been any roadblocks on the way or naysayers on the way, but on the whole, they're pretty receptive. If you take them through the evidence and give them case studies to look at, then they're all ears, really. And we have a real food GP map on our website, and that's kind of growing on a weekly basis. And we've actually just launched an ambassador program where we have local representatives throughout the UK. We've actually got about 60 that we're going to be training over the next couple of weeks, in order to be local representatives who liaise with local healthcare professionals to inform them about what the PHC does, how we do it, why we do it, and how we can help them as well. And that's completely free service. I mean, they're all volunteers, but they're going to be able to show healthcare professionals in their local area the evidence that's out there that they might not have seen, and case studies that show that this approach is more effective in helping patients become healthier, but it's also better for reductions in drugs to help savings for the NHS, essentially, as well. So our next big thing is this ambassador program to help inform GPs, and other healthcare professionals throughout the NHS, in order to really kind of ramp up a bit of a groundswell in which to make us too large to ignore.
Mm-hmm. Yeah, that's how it happens. The more people that keep asking GPs, which for anyone who's listening from the States, if they don't understand what GP means, it's a primary care practitioner, your general doctor. So, the more people that keep asking their house doctor about this, hey, well, I've heard about real foods, this low carb, eating whey, it makes me healthier. Could you help me with this? Then, that helps educate them more and make them look at it more and take it more seriously.
Yeah, absolutely. And the idea as well is to try and get the healthcare professionals talking to each other, because we have a lot of GPs and practice nurses, practice managers, all sorts that are part of the PHC ambassador program and our Real Food GP map, and they speak to fellow healthcare professionals within their local area, and it becomes even more powerful when it comes from a fellow healthcare professional that's local to them, because people inevitably put up barriers, whatever the situation. One barrier is always that, you can do it there, but you can't do it here. But if you have healthcare professionals in your area doing it, then that argument completely falls down straight away. And we've got all of these patient booklets as well, like the Real Food Lifestyle for weight loss. We've got a carbohydrate content insert for the weight loss booklet as well, just so that it's something that you can put on your fridge, so that you can see, okay, these foods are really low in carbohydrate, these kind of are a bit higher in carbohydrate, these are starchy carbohydrates that you should avoid if you're trying to lose weight. And we've also got a real food, real budget one as well, because that's also another argument that comes up, that this lifestyle is far too expensive, yada yada yada. But then when you actually look at the numbers, we took these prices from just Tesco, which is, for international listeners, is the largest supermarket chain throughout the UK. So you'll be able to find a Tesco pretty much in every town throughout the UK. And a pork chop is 64p, a portion of carrots is 6p, a portion of broccoli is 12p, and a portion of onions is 8p. So it's really not expensive at all. And, all of that comes to 90p, which is about $1.10
mm-hmm.
or something like that at the moment, maybe $1.20.
Yeah.
That's a meal in itself. Put some butter on top, you might be looking at a few more pence. But
because your resources page is something I wanted to talk about, because as you said, you got loads of cool PDFs that anyone who wants to educate themselves can download and have a further look. But I really did enjoy that you took the budget aspect of it, because that's something that's hardly ever talked about in any diet that people talk about. They may say, eat this food because it's really good for you, or this amount, but then people at the end of the day only have certain amount of money to spend on food. And I loved it that you actually broke it down to say, right, if you want to eat a really good LCHF meal, so low carb meal, this is what it could cost you right now. And, originally I come from South Africa, and I'm used to cheap protein, cheap meat in Africa. Sure. And when I came to Europe and I came to the UK, it was suddenly like, wow, prices are so much different here. And I love it that you did break it down into that cost. I think that really helps people. And it makes and it shows that it's definitely manageable.
Oh, it's totally manageable. And anybody that says any different is just putting up barriers for the sake of it. What's really funny actually is that the fattier cuts of meat are actually cheaper, and quite possibly could be better. So minced beef, for instance, the most expensive is the 5% lean mince that Public Health England is trying to push on you, but the 20% just unadulterated minced beef is at least a few quid cheaper. So just go for the 20% minced beef.
Yeah,
sure.
I posted an image today on Twitter because I did that where I went down, and that's one of your recommendations. Go to your local butcher and have a chat, because you can have a better chat with the local butcher versus the supermarket butcher. But in that case here, my tip was, we're talking in pounds now. I took regular bacon, and regular bacon for me in my area is about 14 pounds per kilo. When I went to shoulder bacon, it dropped to 3 pounds per kilo.
Boom. There you go. That's a heck of a saving.
Yeah. So you suddenly get meat, same piece of meat. Yeah. It's got a bit more fat on the shoulder bacon, drops from 14 pounds down to 3 pounds per kilogram. Dramatic. And brilliant. So, yeah, that price per meal, a massive plate of bacon in the morning cost me nothing. It cost me like a pound.
That is amazing. That's great. So, yeah, definitely recommend doing that. Have a chat with your butcher and your greengrocer. And see what you can work out.
Yeah. So when you touched earlier on the Real Food GP map, I wanted to actually ask, why would someone want to look at a Real Food GP map? And in this case, if I'm thinking now, maybe more particularly for people in the UK, because they will have their own NHS doctor that they're assigned to.
Yes.
But they're able to still go onto your website, go to this Real Food map, and then have a consultation? Is that the benefit behind this?
Not necessarily. As you know, in the UK, you'll be in a catchment area for your local GP practice, so you're kind of allocated a GP practice in respect to where you live. And for an NHS one, you can always go private and you can go anywhere that you want. But most people in the UK will be going through the NHS. And the real reason that we have that up there, there's a few reasons. One is to show that there are GPs working within the NHS that do this. And their Twitter handle, like some of their Twitter handles are on there, so you can follow them on Twitter if you want, find out what they're up to. It also gives people the opportunity to show their GP that there are GPs out there that are recommending this lifestyle, and that they can get in touch with those GPs. So you can recommend your GP to get in touch with one of our GPs to discuss it, at least. And then, the last one would be that on the off chance that, you come across the PHC and then you look up your local area, you see that a GP working within your practice is a Real Food GP, then you can swap to that GP within that practice, if you see what I mean. But obviously those chances are slim at the moment, but as we grow, hopefully that'll improve things. And it's kind of to keep a tab on, how much the word is getting out there. And just to mention that, not everybody that's supportive, not every supportive GP is on that map. Some wish to remain anonymous at this time until maybe it gets a little more mainstream. So as this movement does become more and more mainstream, then there'll be increasing numbers of GPs on that map as well.
Yeah. Okay. Well, that helps explain a bit more about that map, and it is true what you're saying. I mean, we can think of Professor Tim Noakes, Dr. Gary Fettke. Those are probably the two bigger ones I can think of offhand now, where they're just recommending to their patients, or just to people, just consider eating real food, which might be low carbohydrate, and it's got a healthy amount of fat, and the rest of them, there's people in the medical community who are going after those doctors. So there's going to be doctors who prefer not to stoke that fire on themselves. So I can understand that. Yeah,
that's for sure.
Okay. So we've touched on, sorry, I had some questions here, and we've moved through some of them already there. But actually I wanted to ask, because you mentioned earlier about saving doctors' practices money, and I can think of offhand was Dr. Unwin, isn't it, in the north of England?
Correct.
And he did a study where he got his local NHS practice to save something like £30,000 I wasn't sure if that was total per patient, but just by better managing his diabetic patients.
Yeah, that's right. So Dr. Unwin, Dr. David Unwin, you can follow him on Twitter at low-carb-GP. He's really good to follow because he asks his patients to put their blood work up on Twitter. So, he tweets his patients' blood work quite a bit and kind of shows that, right, this is where they started a low-carb diet and their blood glucose goes like that, their triglycerides go like that on the graph. It's great. Anyway, so he's been doing this for, I think, maybe 4 or 5 years now, but it wasn't always that way for him. He was just a regular GP following regular guidelines and following regular guidelines in terms of prescribing drugs and things like that. And then about 5 years ago, one of his patients came to him after 6 months after her diagnosis of type 2 diabetes, and he didn't recognize her. He thought that he'd called the wrong name on the call sheet or something, and he asked, "My God, what's happened? This is amazing. You've lost all this weight. You look great, and your blood work is fantastic." And she said to him, "Doctor, I'm really sorry. You're going to be very angry at me, but I've been following a low carbohydrate diet." And he wasn't angry at all. He's the nicest guy in the world, Dr. Unwin. And he inquired more and more about this, found out about it, and then he started to advise it because of the results that it was getting for his patients. And over the period of a few years, he's got to the place where year on year, he's saving £40,000 on reductions of anti-diabetic drugs for his practice, in comparison to his local area, which is absolutely incredible. He's the lowest cost GP practice for anti-diabetic drugs. And so the point is that if we're able to replicate that, which we are doing, by the way, across the country in the 9,500 practices that there are in the UK, then we could be saving upward of £350 million a year. And that's kind of a bit of a conservative estimate because that's only on the anti-diabetic drugs. That doesn't take into account the complication costs, which is the majority of spending on type 2 diabetes, such as amputations and surgery for blindness as well. If we can prevent that from happening, then we're going to be saving on complication costs at the same time.
And Dr. Unwin's a part of your collaboration, isn't he?
Yes, so he's on our scientific advisory board. And he's also the national champion for obesity and diabetes for the Royal College of General Practitioners. And he was also NHS Innovator of the Year last year as well. So he's getting a lot of accolades for his work, and the more and more that this happens, and we're starting to replicate this in other practices across the country, then the more and more that we can replicate this, we can show this to the higher ups in the NHS, and then the house of carbs begins to collapse.
I like that, the house of carbs. Yeah, and that is amazing. Just for anyone listening again to think, so one doctor just decides he's going to treat his diabetic patients differently. They get better, and he saves the social healthcare system a lot of money. And that's just one doctor, and that's the thing. If this can be replicated across the country wide, it not only will make people healthier, but the social healthcare system will become healthier monetary wise too. So it's
100%.
I really hope you guys manage to do that.
Thanks, Gary. One of the other big benefits that Dr. Unwin talks about is his work environment, because usually GPs are very overworked, within the NHS. They have very short appointments, and that's because of the large number of people that are coming to them with problems. But what he's found is that by switching to this approach, instead of getting complaints about the side effects from drugs, he actually gets compliments about the reductions in drugs now, which is absolutely incredible. And that's one of the biggest benefits, is that his work life is a lot less stressful, and in fact it's actually enjoyable, he finds now, because he was considering early retirement before this, but now that he's very much enjoying his work and he gets to reduce people's drugs all the time and he gets compliments for it, then it's a much better work life for sure.
Yeah, I can imagine, because I think when I looked a few years ago, the average GP consultation time in the UK was something like 12 minutes or 11 minutes. And they're rammed, their waiting rooms are full. And it must be so stressful to think, oh goodness, I've only got 10 minutes to change someone's life here. What do I do? And, just here's the prescription and they're getting sicker and it just keeps adding on it. And that's not why someone gets into healthcare, to just manage disease that's just getting worse. They'd rather help people get healthy. So I can only imagine how fulfilling that must feel for him now.
Absolutely. And hopefully that will continue to grow throughout the UK, and then we can be a shining example for the world, because we're very fortunate in the UK because we have this one singular system that we can impact upon and use as an international case study to show that it's possible to turn things around with the correct advice and with the right amount of support and enthusiasm as well. We can turn the tide on public health.
And Diabetes UK has also taken up your type of program, haven't they?
Diabetes.co.uk.
Is there a difference?
So this is where it gets a little funky. So there's Diabetes UK, which is the mainstream charity for diabetes in the UK, and their stance is generally towing the line in terms of saturated fat is the devil, and that you should have carbs at every single meal if you have diabetes. It's weird. And then there's diabetes.co.uk, which is a private organisation, and they're a free membership site, which is basically just a forum with articles on it. And they have about 500,000 members throughout the world, and they have a 10-week low carb program that's shown some incredible results. They've had about 150,000 people go through that, and they've shown some incredible results through that. So we've got diabetes.co.uk on our side, which is a patient-driven website and organisation, really, because what's fascinating about diabetes.co.uk is that they started off just kind of supporting Diabetes UK guidance and kind of going along that lines, because they didn't know any better. They were just following national guidelines. And then because it was a forum, it was very patient driven, and it ended up becoming a low carb driven, because the patients were saying, look, why would I want carbohydrates in my diet if I have a disorder of carbohydrate metabolism? Are you crazy? It developed, and they developed a low carb program which has seen incredible results, and they continue to support us. And just to loop back to Diabetes UK, in May of this year, they did come out with a position statement on low carbohydrate diets that say that they are safe and effective for those living with type 2 diabetes. So they are starting to come around a little bit, but not all the way. If you read the wording of the position statement, it's still a little bit on the back foot a little bit, but there's movement. It's the main thing, which is great.
And that just shows your movement with your collaboration is changing the higher ups. It's getting them to change their statements on things, which is fantastic. So is that what you would recommend with the public health collaboration with your resources? Is a good general overview, but if someone who's listening is diagnosed as type 2 diabetic and wants to change themselves, diabetes.co.uk would be a more intensive resource, would it, to help guide them?
Definitely.
Okay.
Yeah. That's got a lot more specifics in it and has a properly structured program to it. So if you go to diabetes.co.uk/low carb, you can sign up to their free low carb program. It's got great videos, PDFs with recipes and stuff like that. Loads of free resources, including letters addressed to your healthcare professional, because you should always work with your healthcare professional on this. But it's about getting them to understand it. And not all healthcare professionals understand this. So they've kind of got letters and things that you can give to them to explain it a little bit.
But this comes back to now what you guys can do by assisting the general practitioners. So as a patient, you could say, look, I'd like to do this. I'm doing a structured program, and here's the information, but here's an organization that is more like GP, doctor to doctor language that could assist you to understand this and the benefits of it.
Exactly.
Yeah.
And that's really what we're here to facilitate is healthcare professionals, mostly, as well as empowering patients too.
Mm-hmm. Okay. And because we've mentioned now the food program that diabetes.co.uk has, but you've also got your own cookbook that people can purchase on Amazon.
Yeah. So we released it at Christmas last year, called Real Food Rocks. And it's kind of public recipes. So we just put the word out on social media and our newsletter and all that, and ask for recipes from people, real recipes from real people, just kind of, photos from their phone. It's not like these cookbooks that you get that kind of, has the washed wood and like everything looks absolutely amazing. They've obviously got a spray and kind of, glistened up the beef burger and stuff like this. It's from real people with real recipes that are practical as well. The idea is that they're family recipes that are practical. They're not kind of with, saffron and stuff like this, it's kind of, quick and easy is what it's all about. And that just gives a little kickback to the charity. Just everyone that's bought gives us a couple of quid.
Mm-hmm.
So
yeah, I'll link to all of these things in the show notes for people to purchase too. So yeah, I love it. We're highlighting that word real. So eat real food, real people, real budgets, real photos, real cookbook. Yeah. It's practical. Yeah. This is real life. So
yeah, that's what I like to think. That's what we're going for.
And I guess just to finish off, you also have a membership area that people can join. So they can buy the cookbook to donate to the charity. They can donate directly, but you can also become a member. I just want to find out, with your membership, is it only for healthcare professionals, or can lay people with an interest in low carb, healthy fats also become members?
Yeah, absolutely. So anybody and everybody can become a member. And the idea behind that is not only do you kind of get a members pack of, a t-shirt and some wristbands and all of the professionally printed booklets that we've got, but you're also contributing to the cause. And we're trying to come up with some extra bits and bobs that members get. But it's for every pound that we get, we're able to send out 10 extra booklets to GP practices across the country, is the idea, because we want to make all of these services for free, and the only way that we do that is from donations from the public, and I'm the only full-time employee of this. And in order to keep costs down, I only take a London living wage, which is £9.40 an hour. So we keep kind of, salary costs at a minimum.
Wow.
Everybody else volunteers their time, and everything else is for free. So, we try to keep stuff to a minimum, and basically all the money that is donated will go towards informing healthcare professionals within the NHS and patients as well.
And then because I didn't get a chance this year, but you had a fantastic conference, didn't you, earlier this year also, that's arranged for members to go to, with some fantastic speakers.
Yeah, so it was our second annual conference. It was up in Manchester, and we had 250 people there, and it was over 2 days. It was at the business school of the Manchester Metropolitan University, and it was an absolutely brilliant time. We had people like Dr. Jason Fung speaking there, Dr. Andreas Enfeldt, Dr. David Unwin, Dr. Joanne McCormick, Dr. Trudy Deacon, Dr. Tamsin Lewis, Dr. Asima Hotra, Dr. Peter Bruckner as well, if people are aware of Peter Bruckner. And lots of others as well, which is absolutely fantastic. And we will be having a third annual one. So if you want to follow us on Facebook and Twitter, you'll be sure to find out when that will be.
Yeah, I think if anyone's interested in this lifestyle and just wants to learn more about the amazing things that are getting released, the presentation slides that I saw from that, it would be the place to go. It would be a fantastic conference to attend.
It was really good.
Yeah.
Really good networking. So if you're into networking with people within this community, then definitely head along. But in the meantime, because the videos from the conference are still being edited, we do have videos from last year's conference as well, the 2016 conference, on our YouTube channel. So if you just search Public Health Collaboration on YouTube, then that'll come up as well. And somebody that I forgot, Dr. Zoe Harcombe, PhD. Mm-hmm. So and she spoke at the 2016 conference as well. So her talk's really good.
Okay, fantastic. Well, again, for anyone listening, on your episode page on the website, there's going to be all the links to all of these resources that you've mentioned, because there's a lot of them.
Sorry about that.
No, it's no problem. I love linking to relevant things and just helping people. That's the goal at the end of the day. And that's why I've got you on for this episode, is because I want people to become aware of people like yourself who are doing amazing things for the low carb, healthy fat community, and just getting the word out there. Because I personally am an enthusiast of that lifestyle too, and I can see the health benefits from it. So any way I can help you too I feel good for doing that.
Much appreciated, Gary. That's great.
Well, Sam, I just want to say before we end up, thank you so much for coming on today, and keep up all the good work.
Thanks, man. You too.